I spent a lot of time on islands. A month ago I was on this island. It's called Santo Domingo. I got avocados this big. But I'm glad to be in Iceland today. And I want to talk to you not just about common diseases, but about the human person. I appreciate what you do. Next week, my mother turns 91. She's in what's called in America assisted living. That means she's in a place where they help her with her life. She lives in a room, she goes downstairs for meals. But what makes it a very special place is the people that minister to her. And it makes a huge difference. I want us to get something in our minds, that old age is not a disease. Now I realize that some of the people that you work with are not old people. You've got some young people too. But I suspect most of them are older. Is that correct?
Yes.
Yeah, most of them are older. Matter of fact, I was looking at this little brochure up here, at the picture of the old lady. And this tells me a great story. What's the look on her face? Is she a happy person? She's not a happy person. And I want to talk first about our attitude. But before that even, I want to talk about what I call the foundation. No matter what you do, if you're talking about health, you've got to go to the foundation. Now I know that you probably don't do a lot of medical things for your people. You might give them some medications. You do other service type oriented things. But this is still important. I'll tell a little story. There was a man who had a very sore foot. So he goes to a doctor complaining about his sore foot. The doctor says, no problem, we'll just give you a shot of painkiller. He didn't like this idea, so he goes to a second doctor. Tells him about how bad his foot feels. Doctor says, no problem, take some of these tablets, that will take care of your pain. The guy didn't like this idea. He goes to a third doctor. Tells him about how painful his foot is. Doctor says, no problem, we'll just give you a cane, and when you walk, lean on the cane. He didn't like that idea. He goes to a fourth doctor. Tells him how bad his foot hurts. The doctor said, we got a solution for that. We'll just cut your foot off. And this is what we see in modern medicine today. If a person has a painful appendix, painful tonsils, painful gallbladder, painful spleen, they just cut them out. And you know what happens with people who get their appendix taken out? More cancer of the colon. Those who have their tonsils taken out, more cancer of the esophagus. So he didn't like this idea. He did not want his leg chopped off. So he goes to a fifth doctor. He says, doctor, my foot really hurts. The doctor says, take off your shoe. He takes off his shoe, and in the bottom of the shoe, there's a stone. Now, what's the solution to the problem? How do you solve this problem? It seems so simple, doesn't it? You just get rid of the stone, and you've gotten rid of the problem. This is a basic principle of health that we don't even think about. What is the principle? Reason from cause to effect. If you've got, right now I've got a little bit of a cold. You know, I came from where I live right now in America, the temperature is about 34, 35 degrees centigrade. I fly over here, I lose a lot of sleep, it makes me weak, I get a little bit sick. I get a cough. What do most people do when they get a cough? What do we want to do when we get a cough? Anything? How about taking a cough suppressant? What's the purpose of the cough? To try to get something that's irritating your lungs out. So we take something that deadens that sensation so it stays in the lungs. And then we'll talk more about this in a moment. All right, health has to do with three things. Once you got this basic principle down, there's three basic things. One is what we put into our bodies. Second one is what we do with our bodies. This is diet and exercise. But to me, the third one is the most important one. It is what we think about life. This is my mother on her 85th birthday. I've known my mother my whole life, and this is the way I always see my mother. She's got a positive attitude. Now, you're going around to a lot of old people. Are they really happy people for the most part? Usually not. Many times they are alone, and being alone is not a good thing. If we can go to the Greek philosophy, and basically our medical system came from the Greek system. And what they did is they had basically the body, that was called in Greek the soma, and then we had the mind, which they called the psyche. What happens when you put both of those Greek words together? What do you have? You have psychosomatic. Is that a Icelandic word? Not Icelandic? What would it be in Icelandic? Okay, basically it is whatever we think is going to happen to our body. It's basically a physical condition that begins in the mind. How many of them? 90%. This is medical science right here. 90% of diseases begin in the mind. Negative attitudes, anger, sorrow, remorse, many, many things. Let me give you a good example of this. There was a man who was in a study. He was in an experimental group. They were trying to find out how much calcium the body needs. So they had this group of people, and every day they got 1,500 milligrams of calcium. And then they would collect their stool and their urine to see how much calcium they were losing. He was losing 800 milligrams every single day. What does that mean? It means his body only needed 700 milligrams. And that went on day after day after day. 700 milligrams is what his body needed. And then, right in the middle of the study, his wife died. He went into depression. And he was no longer losing 800 milligrams of calcium. Immediately, he was losing 2,300 milligrams of calcium. Many, many studies are showing that people who are depressed have more osteoporosis. It's a thing in the mind, because depression is here, but the depression here is going to affect your entire body. Matter of fact, going back to the 2nd century, there was a Greek physician called Galen, and here was his observation. Women who tended to be more melancholy, more sad all the time, had much more breast cancer. That, again, is psychosomatic. Oops, that's in Bulgarian. Get away from there. Has anyone ever... You probably have heard this particular story. I find it to be very significant for this topic. There was once a couple of twins born, October the 10th, 1995. Problem was, one of them was doing really well. The other one was not thriving at all. Matter of fact, the other one is having a hard time breathing, so the lungs were failing. The heart rate was extremely fast, and then one day the temperature started going up and up and up, and they realized they were going to lose this child. Now, there's protocol in hospitals, certain things you do not do. In hospitals at the time, this was in America, because babies, when they're in the womb, are together. As soon as they are born, they separate the twins. They put them in different incubators. And the nurse in charge, just like yourselves, realized we're going to lose this sick child. And so she broke hospital policy. She took the healthy child out of her incubator, took her to the incubator of the sick child. You know what the healthy child did? It was amazing. She put her arm around her little sister. And immediately her lungs were fine, her heart rate went down, and her temperature went down. Just the caring touch of her little sister. And we'll talk more about this as we go along, but folks, we need to show the people that we serve that we care about them. It will do more than all the baths, the washing of the hair, the giving of the medications, and the feeding of them that you can do if you just show them that you care for them as people. See, you have to understand something. And I know that you've got young patients too, and they need to be understood too. But your old patients once were your age. And they haven't forgotten that. They still remember when they were young and beautiful and handsome and whatever, and doing all these wonderful things, and now here they are. And they realize that their lifespan, perhaps, is rather short. And it's a very depressing experience. But we can change that just by showing that we care for them. Another interesting study, they studied 1,300 men in New York City. Men who tended to be angry all the time. You know what the result was? 3 times more heart attacks. I remember I was at a nursing home one time. When people get old, sometimes their children put them in these nursing homes, which I don't like. And I walked by a lady's room. She was sitting in a rocking chair, rocking back and forth, and out of her mouth came one long chain of profanity. Just bad word after bad word after bad word. Something in her mind, something in her life was very negative. She was angry about something. One thing that I try to do with my patients when I'm working with patients is see, is there anything in your life that you're holding inside that is in the mind? Are you angry? Are you sorry? Are you whatever it is? If you can remove that, you're going to completely change your patients' lives. Another interesting study that they did, they looked at a medical school graduation. 25 years, right? A bunch of students were in medical school, and then 25 years later, they went back and looked at their records to try to find out which ones were the most antisocial. 25 years later, almost all of them were dead because it's in the mind. Okay. Another interesting study that they did, Harvard University, looking at 28,000 men between the ages of 42 and 77, and the study took 10 years to do. And here's what they found out. Those people who had good social networks, and this is what the study said, attended church on a regular basis, had far less mortality. So the people that you're dealing with, if they're sitting at home alone all the time, I don't know what you can do about that, but make sure that your time with them is quality. You talk to them, and the most important thing you can do for them is you can listen to them. Johns Hopkins University did an interesting study on things that cause cancer. What really makes cancer grow? The number one thing on the list, which I think is pretty interesting, is our attitude. This is Johns Hopkins. This is a major teaching hospital in America. They say that cancer is a disease of the mind, the soul, and the body. And people who are depressed tend to have more cancer than people who are happy. Matter of fact, let me just tell you a little, it sounds like a strange story, it sounds like it can't be true, but it really happened. There's a large city. There were 2 women in the city that were having some health problems. And they've been seeing their doctors. One day their doctors sent them to a hospital, the same hospital. The problem was not a problem, it happened to be that both of the ladies had the same name. They didn't know each other, their doctors didn't know each other, but these 2 ladies came to the hospital, and they put both of them through the same series of tests. At the end of the day, the women were sitting in different rooms, because different doctors did all the testing. One of them, the doctor walked in with all of the medical records and the test, and he says, well, I got good news, you're perfectly fine. You don't have cancer, a little bit of maybe a little bit of acid reflux, or whatever the situation was, but you do not have cancer. In the other room, the doctor walked in and he says, I don't know how to tell you this, but according to all the tests that we've done, you've got stage 4 cancer and you've got a very short time to live. Well, both ladies went home. The lady who had been told she had no cancer lived fine. She just went great. The one who was told that she had a short time to live died. The problem was the medical records had been switched. Accidentally, it was the same name. So the lady who was told she was fine is the one that had stage 4 cancer. The one who was fine was, you know what I'm saying. It was just what happened in the mind. Depression can do terrible things to a person. Matter of fact, they say that a positive attitude is more of an important health factor even than not smoking. So another way to say this, if you're going to be a unhappy health person, you might as well be a happy smoker because you've got the same health risks. Because I'd rather be a happy health person. Another interesting study, if a person gets mad, is angry for 5 minutes, and that's what I worry about. Some of the people that you're seeing, they've been mad not for 5 minutes, they've been mad for 5 years. But if they're mad for just 5 minutes, it diminishes their immune system for 6 hours. And as soon as you diminish your immune system, you are liable, you are a victim of any pathogen, virus, bacteria that's in the area. But on the other hand, and this is where you come in, if a person feels appreciated, now can you make someone feel appreciated? Just walking in, something as simple as putting your arm around the person and say, I'm really glad to see you today. If you start, and you probably do this, I don't know how you deal with your people, but this is a personal job. You stand between the living and the dead. It's such an important job. But if a person feels appreciated for just 5 minutes, it strengthens their immune system for 6 hours. Can you imagine if you were feeling appreciated all the time? What good things that would do. There's another thing. This is Bulgarian. You've heard of the thing called voodoo? You heard of voodoo? Okay. Does it work? You go down here in these countries like Haiti, voodoo really does work. If you know that somebody has put a curse on you, you're either going to get sick or you're going to die. Now, let me ask you, is poking a pin in this little Cupid doll going to make you sick? No. What makes them sick? It's in the mind. Because they believe with all of their hearts in the power of voodoo. And I work in many countries where they have voodoo, and it's amazing. I'll go to see my patients, and I'll walk in, and they've got ceremonial burns on their body. They've got ceremonial cuts on their body because they've seen the witch doctor, and they're seeing me. I don't understand it. But now, there was an interesting study done. They took 34 university students, and they said, look, we're going to put this thing on your head, and it's going to let out just a tiny little bit of electrical waves. You won't feel it, but it sometimes puts out a little bit, and it'll be fine. Yeah, there you go, little electrical waves. And so these people all put this thing on, and they sat there for a half hour and took them off, but they told them something. Some people, because of the electrical waves, will get headaches. Well, how much electricity do you think they put through these girls' heads? They put through no electricity. There was no batteries, there was no electricity at all. They were just told that you might get a headache. How many of them got a headache? 2/3 of them got a headache. Why? Because they were told some people get headaches because of the electrical current. A good example. In the country of Italy, they were doing a study. They were trying to find out They were using a placebo that they told people it will help you sleep well. It was a nice, pretty blue pill, and they says, you take this pill, it will help you sleep. Well, the funny thing was, for the women, it worked great. This was a placebo, it had nothing in it. But for the women, because they believed it, they went to sleep, no problem. But the men, they couldn't go to sleep. Why? Interesting. It was the color of the pill. What does that have to do with anything? The national football team in Italy wears a uniform the same color. And they were doing really bad. And so the person would take this blue pill and say, oh, our football team is doing really bad. And it lay there worrying about their football team and not sleeping. It's all in the mind, folks. And we have to deal with these things. All right, now, I've already talked about one. I talked about coughing. What is a cough? Let me ask you another one first. What is pain? Does anyone know what pain is? Now, you can give me probably a long scientific explanation, but simply, pain is a signal that tissue is being damaged. That's all it is. A year ago this week, I had a bicycle accident. I was mountain biking, coming down the hill. I had a wreck. I broke 7 bones. Now, when you break a bone, if you can't feel the pain, I had many fractures of my pelvis. If you have a fractured pelvis and you can't feel the pain and you keep on walking, what are you going to do? Any idea? Is it going to be good for you? Is the pelvis going to heal? No, it would not allow me to use it. I had 5 broken ribs. If you don't, has anyone ever had a broken rib here? It's bad, isn't it? You can't even take a deep breath. Well, matter of fact, can you stop a sneeze when you get it? Can you stop a sneeze?
Yes.
You can if you have a broken rib. You go, it stops because the pain is exquisite pain. So basically, we've already mentioned a cough is an attempt of the body to get something that's irritating the lungs out. A sneeze, same thing. There's something in the nasal passages that is irritating. And so we want to, the body says sneeze, and we get some of this stuff out. A temperature, a fever. Is that a good thing or a bad thing?
Can be good.
It can be good. What causes a fever? A fever is a part of your immune response. When a person gets a fever, the body says, well, first we get invaded. Bacteria, a virus, whatever else, it gets into the body. The immune system recognizes this thing as a pathogen. So the first thing it does is sends a signal up to your hypothalamus, a little gland in the middle of your brain, and it says, turn up the temperature. Why does it turn up the temperature? Because a virus cannot duplicate at about 87.3 degrees, I think it is. 37. 38. 37 is normal. 38.3 degrees. It cannot replicate anymore. But what do we do when we get a fever? What do most people do when they get a fever? Yeah, they take a tablet, okay? Let's say you take an aspirin. What does the aspirin do to make the fever go down? Have you ever thought about that? I'll tell you what it does. It poisons the hypothalamus. And so now the hypothalamus isn't working and your temperature comes down and your viruses can go crazy inside your body. We had a patient come to Uchee Pines, the place where I work, back in the late 80s. She had lupus. She had depression. She had rheumatoid arthritis. She could not sleep. She could not digest food. She was a total, what we call, a basket case. She was such a sick person. So, and when she got there, she was taking 32 medications. 32 medications. So one day I took her list of medications, I sat down, and I got this big book we have called a Physician's Desk Reference. It has every drug in that we have in America, and it tells me the main side effects of the drug. So anyway, this lady had high blood pressure. So I looked up the medication she was taking for the high blood pressure, and then I looked up what the main side effect of that medication was. It turns out that it would make her tired all the time. So what the doctors do, they gave her medication to keep her from being tired all the time. I looked that up in a book, and that medication's side effect was it caused her to be agitated sometimes. Well, because she was agitated, they gave her another medication, and it kept on going and going and going. She was taking all of these medications for side effects of her medications. In one day, we went from 32 medications to 4 medications. In 3 weeks, she was on no medications. In 3 weeks, she had no physical problems in her body. She was completely free of her sickness. And this happens all the time. I've seen this happen over and over and over again. Drugs don't cure disease. Now, I know that you are probably giving medications and you want to keep on doing it, that's fine, but all medications are for is symptoms. They're not for cure. I don't know of one medication that actually cures a person. It just takes care of the symptom that they're having. All right, another concept we need to get into our minds, because most of the people that you deal with are what we call toxic. What does it mean, toxic? They've been living in this life for so long, they've built up so many toxins in their bodies. Now that said, this is a pretty good place to live. I mean, you got clean air, you got fantastic water, it's real, and you're not allowed to grow GMO here. But even with this, as I've been discussing in other lectures I've been giving, you have pollutants coming into the air and through the water, and they're getting into the bodies. So this concept of biomagnification, they did an interesting study. They looked at the amount of a certain insecticide in the water, and it was called DDT. Okay, this is an insecticide. It was what they replaced DDT with. Now they got DDT. In the water, the pristine clear water like you have here, the level of concentration of this pesticide was very, very low. 0.02 parts per million. Negligible. Now there's some parts of the world where it is skyrocket high. Thankfully you don't have that here. But living in the water, there is a thing called plankton. Plankton are little plants that live their whole lives in the water. Because they're in the water with this small concentration of DDT, they're going to start putting it into their cells at a rate of 5 parts per million. That's still quite low. Living in the same water, there are some fish. They are called herbivorous fish. They eat the plankton. And as they eat the plankton, they are getting the 5 parts per million, but it becomes a part of them, so they go up to between 40 and 300 parts per million. You see how it's magnifying as we go up? But in the same water, there are other fish that eat the herbivorous fish. These are called carnivorous fish. And all the fish that you eat here probably are carnivorous fish. It can be up to 2,500 parts per million in the carnivorous fish. All right, what's the next stop on the food chain? All right, now we're going to cook it up, and it stops with us. Now we're eating a carnivorous fish that was toxic from the environment that it lived in. We are going to start storing the toxins in our bodies. What can we do to detoxify our bodies? Anything you can think of to help detoxify? I'm going to just give you some simple suggestions, because all of us should be detoxifying on a periodic basis. One, water is called the international solvent. If we were drinking about 3 liters of water a day, we would flush a lot of toxins out of our bodies, help our kidneys stay clean. Another thing is sweating, a good sweating treatment. Now you've got lots of thermal areas up north of here, but if you could, I mean, your water in your houses, this thermal water, I mean, it's hot water. Taking a bath in hot water, getting you sweating, you sweat out toxins. Keeping your liver clean, taking lemons is very good for your liver. But we need to try to detoxify our bodies. Cancer is a major problem. They do huge amount of research on cancer. One day, a bunch of scientists and doctors got together and they took 4,500 studies that had already been done. And they read every single one to say, what have they found out? Why do we still have cancer? Will we ever have a cure for cancer? You don't think so? I don't either. Why won't we have a cure for cancer? It's all about money, folks. There's a lot of research. 4,000. Can you imagine how much 4,500 studies cost? This is beyond my scope of understanding what the monetary system is. But they sat down, honest men, to find out what did they tell us. And here's what they found out. We don't need any more research. If we do what these studies already say, cancer rates would go down. It's that simple. What did they find in these 4,500 studies? It's all about the diets that we eat. Matter of fact, this is one of the most powerful anti-cancer foods there are. Matter of fact, anything in this family, this is broccoli, there's cauliflower, there's cabbage, bok choy. There's many foods in this category that are anti-cancer foods. Our patients, when we have them come to my place, where I work in America, they all get a diet high in these types of foods. And I've seen cancers go away with our patients. We're talking about in 18 days. Another scientific study coming from the medical journal called Toxicology. These are all medical studies. These are all scientific double-blind studies. They say that 1/3 of all cancers are coming from tobacco. That's a crazy thing. But 1/3 is coming from the diets that we eat. Now, to me, this is great news. What's the great news? If we could stay away from tobacco and eat a healthy diet, what did we just do? Reduced our risk of cancer by 2/3. Now, maybe you're not too concerned about that. Because frankly, here in Iceland, you've got a very low death rate. You've got one of the longest, matter of fact, an Icelandic boy has the longest future, longest lifespan of anyone in the world. I think it's 81.3 or 4 years. It's really, really good. But in I think it's 2009, I can't remember the numbers right now, but people are still dying. And I'd rather not be one of those that died of the cancer. This diet thing's interesting. There was a man named Thomas Parr. He was born in 1483. He died in 1635. Do the math. He was an old man. He lived during the reign of 10 British monarchs. He's from England. He lived through all these kings and queens, but he was just a common, simple farmer out there farming his land, which is one of the reasons for his life.